If a patient's record is made of paper, it can only be in one place at a time. It can only be seen by one person at a time. And it can spend an awful lot of time in transit waiting to be filed or lost. But electronic records open up a world of possibilities, from linking patients directly via telehealth and telecare to their GP practice, to enabling population-level analysis of vast reams of data. I was at the NHS Innovation Expo last week. It was my second visit and noticeably very different from the last one. For a start, I've never seen so many iPads in my life. It appeared that every stand was doing something extraordinary with patient data. One company, First Data Bank, is working with clinical commissioning groups, running its complex algorithm through all of their patient records. They looked at people's various conditions, their age, their gender, and such like, and cross-check these against their prescribed medicines. And in an instant, they found that as many as 10% of their patients had safety issues with their medication. They will now be able systematically to revisit those prescriptions and, one hopes, improve the lives of their patients. And that's just one illustration. And it's only a tiny example of what we hope and expect to see in the NHS more generally, which is a culture of innovation. And by that I mean an awareness on the part of everyone working in and for the NHS, from the CEO to the doctor to the nurse, right down to the hospital porter, an awareness that innovation is everyone's business, their business. And in a world where budgets are likely to remain constrained for some time to come, doing more of the things that we've always done in the same old way will not be enough. Innovating, doing things differently, is going to be not just a nice to have, but an absolute necessity if the NHS is to continue to deliver improvements in the quality of care to patients. Remarkable things will be possible as we bring about a culture of openness and transparency in the NHS. But there's another aspect of transparency that we need to get to grips with as well. Next week, Jeremy Hunt will present our initial response to the Francis report into the horrible events at Mid-Staffs. I'm not going to preempt that response, but I can tell you that the focus of it will not be on further regulation, more red tape, more rules to stop doctors and nurses from getting on with their job. Instead, it will be about getting the right people into the NHS, giving them the freedom and support they need to do their job to the best of their abilities, and putting patients in greater control of their own care. And as Robert Francis said in his report, what is required is a fundamental change to the culture of the NHS. And it is that change in culture, that focus on patients, that I hope we can turn to collectively now. The debate about structures and systems has been important, and the changes will enable us to focus on patients far more than we ever could have, I think, under the previous system, or, to be correct, for the next week and a bit under the current system. Significant change is coming to the NHS and social care, but it will be change that is focused on patients, led by clinicians, and open for all to see. And that makes me, for one, feel extremely positive about the future.